Spanning the planet. You've landed at the pet entertainment center of the universe. Alert the paparazzi. This is Pet Life Radio, the ultimate animal adventure.
And welcome, and happy Sunday to all. Good morning if you're out here in the west by me, or good just break of that afternoon if you are in the east. And hope all is well with you. We are enjoying a nice, clear, beautiful day out here. Hope yours is the same. Very curious to know how everybody did Halloween-wise. It's interesting. Here I am promoting all the things you need to do and all the things you need to be careful of. We talked about it a lot last week. And so what I usually do for my office is I will bring some candy just for my clients. So, we put them out on the counter in the front. So I had two bags. One was Nestle's Crunch. One of my I always get my favorite. That way, if people don't eat them, at least I'm going to enjoy something that's left over. And Snickers. Well, I had the bags here in my home office. Now, mind you, my dogs are, especially my Labradors, are insane when it comes to getting into things. They are masters. And I literally have to have baby locks on cabinets because they know how to get into cabinets. And I have to block the kitchen door so they don't get into the kitchen if they're in the house. And anyway, so I had them. I totally didn't realize they were in my office. I figured, that's safe because they never go into my office. All of a sudden, I get a call. I forgot to bring the bags. And there's my lab. My old lab, 13 and a half. Now, mind you, this guy can barely get upstairs, but he can jump on top of a counter and for food. So he gets into about 10 of those little teeny Nestle's Crunch. He's 85 pounds. I'm not worried about the toxicity issue with milk chocolate, et cetera, et cetera. But, he doesn't like to take things out of wrappers. He thinks, I'm going to smell it right through the wrapper. I'm going to eat the whole thing. So I knew this happened. I figured some of the stuff would come out of his poop. I wasn't too worried about it. And since then, he ate so that was Friday morning early. He ate Friday evening. He ate Saturday morning, right? He ate all these meals. And late last night, I hear him upchucking. I hear that typical, that vomiting thing. And out comes, now mind you, he's had normal meals and normal poops over this last day and a half. And all of the wrappers in a bunch came up in his vomit. It's like, I'm thinking about how does the food get by and go through the intestine and get digested and all is fine and develop a nice firm stool. And the wrappers, the Nestle's Crunch wrappers are still there in their entirety. Anyway, I hope you guys had better luck than I did. And as I used to say to my kids, do as I say, not as I do. Because I am the worst lesson to learn from when I do stupid things like that. Anyway, I'm glad you're here with me. I'm Dr. Jeff Werber, your host for today's Ask the Vets with Dr. Jeff here on Pet Life Radio, an iHeart radio station partner. And we're here for you. In fact, it's easy to get a hold of us. And last week we did get a caller. Well, actually someone wrote in, joined in on the conversation, which you can easily do if you are shy and you don't want to call us at 877-385-8882. You can just go online to petliferadio.com, click on Ask the Vets with Dr. Jeff tab, and on that page you will see a little box that says join the conversation. Log into our live chat during the show. Please do so. Last week we did get someone who called in, and also you can email me to drjeff, that's Dr. Jeff at Pet Life Radio. Look, we want to make your lives easier. Just think about all the benefits. The benefits of joining us either via phone or joining the conversation. The following. Hopefully, you're going to get some answers to your questions. And if I don't have the answers, I will get them. As a general practitioner this is my 31st year, I kind of know a lot. But when it comes to really tough things, I have a great network of experts in pretty much every specific discipline, so I will get an answer. Secondly, it's free. It doesn't cost you a dime. My goal here is to help you and maybe even help you save a little money in the process. And of course, we're here thanks to our sponsors, Prosense Pet Products and Kong. As a matter of fact, when you call, not if, but when you call, when you join in on the conversation, we will send you out a Prosense Pet Product as well as a free Kong toy. And Kong toys are great because they're therapeutic at the same time. And anyway, so you have no excuse not to join in. So first of all, I would love to hear about any Halloween stories the good ones and the bad ones. If you had a problem, if you had a dog that got out, if you had a cat that got out, if you had a dog that was growling at some of these kids, whatever. We want to know about it. So again, 877-385-8882, or just kind of join in the conversation, and we'd love to hear from you. What I wanted to do, and we've been sort of going through, and until you contact me to speak about a specific subject, which I'm happy to do, I have a game plan, my lesson plan, as you will, as if I were a teacher. And what we're going to do now is we're going to cover the very many endocrine diseases. These are diseases of the hormone system of the body that seem to go astray and awry at certain points. And most of these are fairly easy to diagnose. Some are more difficult. Some of the growth hormone problems can be very tough, but they're somewhat easy to diagnose, not always easy to treat. Very few are curable. However, we can control them. There are great medications, great choices we have. Some, believe it or not, are pretty much curable, where when you're done, you don't have to do a thing. But those are the rare ones, but we'll get to all of them. So what I wanted to do is we have a gland in our body called the adrenal gland. It is basically attached to the cranial poles of our kidneys. And the adrenals have different zones within the gland, and they're responsible for the sex hormones, for the mineralocorticoids. Those are the hormones, if you will, and that will control the mineralocorticoids, which are like our calcium and phosphorus balances. And so, that's very important for the body. Sodium, potassium, also very important to the body. And also the glucocorticoids, which are the steroids that our body secretes. Basically, I'm sure you've heard of a drug, prednisone, or any of the corticosteroids that are used to treat many conditions in pets in different dose ranges, depending on whether we need an anti-inflammatory component or whether we need to have an immunosuppressive component. So there's some different dose ranges. But the adrenal plays a major function. And the signal for the adrenal to work usually comes from a gland in the brain called the pituitary gland. And there's a number of feedback mechanisms where the body is able to read what's already there and then, with a healthy gland, make necessary adjustments. And whether it's going to make them on its own or make them as a result of secretion from the pituitary gland. So the pituitary gland sort of is the master gland that dictates for the adrenal what to do. And when the adrenal gland the pituitary gland senses that, for example, we don't have enough necessary adjustments, and signal the adrenal gland accordingly. Well, there are two conditions that we frequently see, and also the effects are a little bit different, where concerning the adrenal gland, where one is an over secretion of the adrenal gland, and the other one is an under secretion. And the one that we see more commonly is the over secretion, and we call this Cushing's syndrome or Cushing's disease. Technically, and the Cushing's syndrome is actually where the problem is coming from the brain, the pituitary gland. And the pituitary gland is over-firing, over-signaling the adrenal gland to secrete its glucocorticoids, not really listening to the rest of the body when the body says, hey, slow down. We got plenty of cortisol running around our blood. We don't need any more. And it just keeps on firing and signaling, and that is Cushing's syndrome. Cushing's disease is where the problem is actually coming from the gland, the adrenal gland itself. Pituitary has nothing to do with it. It's all coming from the gland. There's a functional increase of secretion coming from the adrenal, and that's Cushing's disease. The reason why there is somewhat of a difference is that when it comes to treatment, when you can clearly identify Cushing's disease, it might be easier, well, not easy, but it can be treated by removing the adrenal gland. Obviously, that's going to require the hands of an excellent technical hands of a surgeon, but can be done. Whereas, obviously, if the pituitary is the problem, so it's really, by definition, Cushing's syndrome, you can't do that. So that we have to rely on medical therapy. So what are the symptoms? And this is what's so important, because a lot of the symptoms that we see with some of these adrenal diseases, or these hormone diseases, are very similar. For example, a dog comes in and it's classic Cushing's. I got a funny story about my early days in practice with this condition. And it is a dog that comes in, and the chief complaint from the owner is, my dog is drinking water like crazy and peeing like crazy. Now, there is another disease we're going to get to, probably not this week, but maybe in a couple of weeks, and that's diabetes. Two types of diabetes mellitus and diabetes insipidus. And guess what? They too present with dogs that are drinking and peeing like crazy. So from that perspective, we have to be very careful and make sure we get a thorough history and make sure we, etc. But Cushing's disease, typically we call it PUPD, polyuria, that's excessive urinating, and polydipsia, which is excessive drinking. Other things we see with Cushing's, we see kind of like the body is changing. The skin is getting kind of thin and oily. Sometimes we'll see hair loss that's not associated with scratching. The skin, the belly looks bloated. Basically, a lot of the changes we see are the same changes we're going to see in a dog that we have to treat with an excessive amount of corticosteroids for whatever disease they may have. So I'm sure you've seen people that have had to be on steroids for a long time, it's similar type of changes take place in the body. So you get that thin, sometimes greasy looking skin, thinning hair, big bloated belly, PUPD, excessive drinking, excessive peeing, and you say to yourself, oh my God, this is classic Cushing's. Now, at this point, you still don't know whether it's Cushing's disease or Cushing's syndrome, but it's Cushing's. So now the fun begins. And that fun is we need to start doing some tests to see where our problem is, and to try to make a determination, because the disease actually is not curable, but it is treatable. It is controllable. And we have many cases of dogs with Cushing's that are just doing just fine. There is actually a relatively new drug. When I say relatively in veterinary world, that means that it's not like yesterday, but it's been around for probably 7 or 8, 10 years maybe, and it is a major improvement over the drug that we used to use back in the day when I started practicing. So there's some new things out there that are great. Also testing. One of the tests that we used to use is still used often, but there's another test that many of the experts like a little bit better. So we use that one too. And this other test, the one that's a little bit better, might actually help us determine the difference between Cushing's disease and Cushing's syndrome. And of course, with the advent of ultrasound in the hands of an amazing ultrasonographer, the adrenal gland sitting right by that kidney is often visible, and it can be measured, and a determination can be made merely on ultrasound whether we're dealing with the adrenal problem or the pituitary problem. So there's a lot to do, a lot to talk about, and we will as soon as we come back from our quick break. So stay tuned. We're learning about Cushing's disease in dogs predominantly, and we'll be back in just a few, and we'll talk about testing, and we'll talk about treatment, and we'd love to hear from you if you have any questions about your dog that may have, or your concern might have Cushing's, or is currently being treated. We'd love to hear from you and get your input as well. Here, 877-385-8882. We'll be back in just a minute.
Let's talk pets.
Let's talk pets
On Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
And welcome back, and thanks for being here. You're here with Dr. Jeff Werber, your host here on Ask the Vet with Dr. Jeff here on Pet Life Radio. And before the break, we were getting a little science here, kind of education about a disease we commonly see in dogs. I shouldn't say commonly. In veterinary medicine, or in medicine in general, we get to use the term, it's not uncommon. Now, usually, if you look at it double negative, well, if something's not uncommon, you'd say it is common. But common means it happens a lot. When in medicalese, when we say it's not uncommon, it just means it's not uncommon. Uncommon is something you rarely see. So if it's not uncommon, it's not that we don't not rarely see it. We don't see it a lot. It's not common. So you you have to be very careful in using the term. So when we say something that's not uncommon, it means, yeah, we see it. We see it, kind of frequently, but not a ton. But it's not surprising. It's not like, my old expression I've shared with you before, that you're running along the beach, and I'm going to use Malibu because I'm here in Southern California. So you're running along the beach in Malibu, and you hear hoofbeats chasing you from behind. Are you thinking horses or zebras? So you're not thinking zebras. So you're thinking horses. Now, so therefore, when I say something's not uncommon, it's not a zebra. It doesn't mean you're going to see it every day, but it's not something that, oh my God, I'm going to, I got to call Guinness Book of World Records here because I got a case of Cushing's. So we are talking about the testing. First of all, you have the clinical disease. Clinical disease, once again, you have the dog typically that's drinking water like crazy, therefore peeing like crazy. Their skin is very thin. They have a bloated belly appearance, sometimes a sway back. They're losing a little bit of muscle tone, some hair loss, and we call it endocrine alopecia. And the reason why we say endocrine is because usually the endocrine alopecia meaning hair loss, they are more symmetrical, and they're not associated with scratching. So if you look at the skin itself, you don't see scabs and sores, things like you would typically see with allergic condition. And if you're sort of like, if you were to mentally, don't do this at home, folks, but if you were mentally going to chop the body in half along the longitudinal axis, the right side will look almost exactly to the left side, like mirror image. That's what we call bilaterally symmetrical. And that's what we see with these kinds of alopecias with our endocrine diseases, if they are going to be endocrine alopecias. So testing. So we get a good history. And the first thing, of course, we're going to do is do a basic blood test. And one of the things that we pretty much often see when we do our basic blood test is going to be an elevated alkaline phosphatase. Now, the alkaline phosphatase is one of the 4 major liver enzymes that we often look at. And we know that dogs that are on certain medications, like corticosteroids, also like phenobarbital, but like steroids, when that dog is on chronic prednisone for some reason, or prednisolone, or dexamethasone, or you name it, they're going to have an elevated alkaline phosphatase. Well, when we have a dog with Cushing's, where in essence the body is giving itself too much cortisone, we're going to see an elevated alkaline phosphatase. And I mean elevated like high normal, is like 100 to 130, depending on the lab you're going to use. We're talking dogs that present with values over 1,000, 800. I had a dog as high as 2,500. I mean, 3,000. It's ridiculously high. So given the presentation, the PUPD, the skin changes, the sway back, all that stuff, and an elevated alkaline phosphatase, that is highly suggestive. Note that we did not say it's diagnostic. These are things that are highly suggestive. And the reason I say that is we've had dogs that present atypically, where they have all the PUPD, the drinking and the peeing, they have their skin, the body changes, but their alkaline phosphatase is totally normal. Are you going to stop there and say, no, it's not Cushing's? Of course not. It just means that one major test, that major clue isn't there. So now comes one of the real tests that we do to determine the disease, and that is called, well, they're one of two. Back in the day, and it's still used, nothing wrong with using it, it's called the ACTH response test, the adrenocorticotropic hormone response test. How does this work? Well, this is basically the following. We know that a dog that is going to have a stimulation of the adrenal is going to have a normal increase in its output of adrenal, of the hormone. So basically, the ACTH typically comes from the pituitary gland in the brain, signaling the adrenal gland to fire, and it releases its hormone, its cortisol. But dogs with Cushing's, as I said, they don't look at your normal type of release of the cortisol from the adrenal gland. They go gangbusters. So we know what the normal dog does. So what the ACTH response test does is we give a certain measured amount of the corticotropic hormone, and then depending on what we use and which technique we use, whether it's given IV or IM, but 1 to 2 hours later, we then go ahead and remeasure the cortisol level in the blood, and if it is off the charts high, then we assume Cushing's. Another test that seems to be a little bit more in vogue now is called the low-dose dexamethasone suppression test. As I also mentioned, typically, dogs respond. There's like a feedback mechanism continually going on between the pituitary gland, the bloodstream, the amount of cortisol in the bloodstream, and the firing of the adrenal gland. So what happens is, if we give the body a measured amount of cortisone in the form of dexamethasone, then the normal dog, sensing and seeing the body has plenty of cortisol on board, will shut down and stop secreting, and therefore the adrenal gland will not secrete any more of its own cortisol. Basically, the pituitary and the adrenal combined, whether it's your Cushing's disease, Cushing's syndrome, is basically saying, hey, we got enough, we don't have to work. Sit back and relax. But dogs with Cushing's don't. So what we do is, even though we're suppressing with the dexamethasone, we are still seeing firing. And based on some calculations and measurements, this test, if we have, it's a blood test taken, we inject the steroid, we take a follow-up at 4 hours and at 8 hours. And then at 8 hours, depending on the levels, you can determine that whether the problem is coming from the actual adrenal gland, meaning Cushing's disease, or the pituitary gland, meaning Cushing's syndrome. So that's why a lot of the internists like it, because it helps us. And then, of course, if we really want to try to suppress, then you go in and do a high-dose dexamethasone suppression test. With a high dose, basically the normal, if it's a normal pituitary problem, it's gonna suppress, and then we'll know if it's still not listening to us. Most likely, then we have a adrenal problem. So if those tests are abnormal, then we have and have a suspicion, we can do the next step, and that is, well, to really confirm, let's go to the ultrasound machine. And with the ultrasound machine, again, in the hands, a lot of general practitioners may not have the skill or the quality of ultrasound machine to actually make this determination, but certainly the internists do. And that is, let's go ahead and check out the adrenal gland at the kidney through the ultrasound and see, does it look huge? So if the assumption is everything checks out, that we have Cushing's disease, so now it's time to treat, and the treatment options are quite a few. There is a drug that we all used to use years ago called Lysidrin. The chemical name was either Mitotane or OPDDD, and that was a drug that would actually suppress the adrenal gland. It would actually eat the adrenal gland up. In fact, one treatment in Europe, what they do is they used to give the OPDD so much that they used to obliterate the entire gland and then treat the dog as an Addisonian, which is the disease we're going to talk about next week, which is an under-secretion of the adrenal gland. That's Addison's disease. And Addison's disease dogs are actually much easier to treat. So in some places in Europe, I think in Sweden, their treatment of Cushing's is to, let's make them into an Addisonian and treat. We never did that here. We tried to titrate, I should say, how much OPDDD could be given. There's a newer drug called Trilostane. It was first used in Canada a lot, now under the trade name Veteril, that most of us are using. And that is, again, measured by weight. And its goal is to, again, decrease the amount of output put out by the adrenal gland, and thus monitor these dogs via the ACTH response test. So even if we made the diagnosis originally using the low-dose dexamethasone suppression test, we monitor our success on the Veteril using the ACTH response test. And that drug is very safe. Dogs do very well on it. And of course, if we have confirmation via our testing and our ultrasound that our problem is most likely the adrenal tumor itself, then of course, in the hands of a qualified surgeon, that adrenal gland or the adrenal glands can be removed. And then again, we're going to have an Addisonian, and then we treat accordingly as we would in Addison's, which we're going to cover next week. So the options are many. These dogs can live somewhat normally. We do see some complications, however, in that some dogs that have Cushing's might also have diabetes going on at the same time. That's a disease we're going to cover in a few weeks, that diabetes mellitus. Now we get complicated because it's almost like the treatments are opposing each other, because the anti-insulin effect of high-dose steroids, and then now we're giving, we have a disease that is secreting too much steroid. We get this anti-insulin effect because of the steroid. That's where it gets very, very complicated. And these dogs are a lot more difficult to adjust, but it can be done. I'm in the midst of treating one right now. We've been, kind of going on for a while. Good old Lucy, who has both diabetes and Cushing's, just to, throw us a hell of a curve when it comes to treating these endocrine disorders. So again, to recap, Cushing's disease, it's a adrenal and or pituitary problem. It's an oversecretion. The body is presenting too much cortisol. The changes in the blood will usually dictate that. Behavior changes will dictate that. The skin, how these dogs present and look, will dictate that. And so our job is to minimize that secretion, to regulate it as best we can. We have a number of drugs or surgery available to us, but don't fret, because it is a condition that we can and often do work with. So if you have any questions about Cushing's disease, Cushing syndrome, if you have a dog who's being treated or has been treated, or you've had a dog in the past, we would love to hear from you, find out how it went, get your input, because other listeners are going to learn from you just like they can learn from me, because you've been there, done that. Here I am, been treating this for years. I've never, in all my years of being a pet dad, a dog dad, have had a dog with Cushing's disease, or diabetes for that fact. I shouldn't jinx myself, but so we want to hear from you to see how things are going for you. How's it working out? Are you happy that you're treating? Do you have any doubts that maybe you shouldn't have? This is what we want to know. So I want you to give us a call next week, or send me an email and I'll share it on air to drjeff@petliferadio.com. Or you can give us a call next week. We'd love to hear from you, as we're going to be talking about Addison's disease, which is the opposite, the undersecretion of the adrenal gland. And you can give us a call at 877-385-8882. Thanks for joining us here. I'm your host, Dr. Jeff Werber. Thanks again to our sponsors, Prosense and Kong. And we will see you here next Sunday.